this is Dr. Lakshmi Chetty from Jayadeva Institute of Cardiology. Today we'll be discussing about pre-diabetic state. Now, what does one mean by pre-diabetes? Now, a pre-diabetic state is usually more commonly seen in those patients who are obese or who are overweight, and these patients also usually tend to have associated physical inactivity, hypertension and dyslipidemia, that is abnormal cholesterol levels. Now, somebody is diagnosed as a pre-diabetic only when we find that their fasting blood sugar is done after 8 hours of fasting falls somewhere between 100 to 125 milligram per deciliter, because more than 126 milligram per deciliter they are labeled as diabetics. The two are postprandial if it falls between 140 to 199 milligram per deciliter, because more than 200 milligram per deciliter again they are labeled as diabetics. And if their HbA1c falls between 5.7% to 6.4%, more than 6.5%, they are labeled as diabetics. Now, the most important thing about this pre-diabetic state is that especially those patients whose HbA1c falls between 5.7% to 6%, it is noted that their 5-year risk of developing diabetes is anywhere between 9 to 25%. But for those who fall between 6 to 6.5, their 5-year risk of developing diabetes is as high as 25 to 50%. And also, these last group of patients are also more prone for cardiovascular diseases. So it is very important that in this pre-diabetic state, all patients initiate proper weight loss measures and also take up a healthy lifestyle. So for a proper weight loss, these people have to take up regular exercises, which is at least for 30 to 45 minutes daily. And they should target a weight loss, and also they should adopt a healthy lifestyle. That is, along with exercise, they should also eat healthy. What do we mean by eat healthy? In the sense to cut down fatty foods and those foods which are rich in carbohydrates. It is better their diet is more or rather is having higher proportions of protein and vegetables and fruits. And also, as I already mentioned, regular exercise is very important. So a pre-diabetic state is very important, and these pre-diabetic patients I told are are at a high risk of developing diabetes and cardiovascular diseases in future, and hence they have to really take care of their health very well. And also, these patients need to be screened at least once a year with all these blood glucose parameters, or earlier if in case they develop symptoms of diabetes. Thank you.